Hello, I'm Toby Peach and welcome to another edition of Trekstock Talks. This week we're going to be discussing treatable, not curable cancers. This subject has been one that's been requested by the Trekstock community and one that we're so pleased that we're going to be able to discuss today as we think it's really important. So let me introduce you to our specialist today. So we have Kate over here, who is a clinical nurse specialist and she's actually working on a special project at the moment. We're working with Macmillan, that's right, which is living with and beyond cancer. And so we're very fortunate to have you. Thank you so much for joining us. And we have Sarah West over here, who is living with treatable but incurable breast cancer. And so we're going to get started in discussing this topic. So I'm hoping I could start with you, Sarah, if that's okay. And to learn a little bit about you and how you've come to be sat on our lovely sofa here at Trekstock.
So I was diagnosed with breast cancer last February 2017 after having visited the doctors twice with just some niggles and pains. And then I was sent for a just standard CT scan, full body scan. And sadly that's when they found it had spread to my liver, lungs and bones, which therefore created a new terminology of metastatic breast cancer, which I had no idea what that meant. Obviously I'm an expert now. And yeah, so I was treated with docetaxel, which is a chemotherapy, quite a strong chemotherapy, and Herceptin inotuzumab because my breast cancer is HER2 positive, so it's another additional targeted treatment, which is really good for my type of cancer. And that went really well, and everything was shrinking, it became stable, and then sadly in September, October time, I started to get some niggles in my head and it's sadly spread to my brain. So I had radiotherapy, which was really tough, much tougher than I expected and much tougher than the chemotherapy. But coming out the other side now, I'm on constant Kadcyla, which is every 3 weeks, but I feel really well, feel really good. So. And
so that next stage and learning about like having the radiotherapy, and had you had any symptoms at all that made you think something else might be happening?
Yeah, we went to, one of our bucket list activities was to take the girls to Disneyland, Paris. So we went there and I just felt incredibly tired, irritable, more so than usual, and intolerant. Yeah, I just felt something wasn't right. And then I started to, if I was looking at somebody's face, the left-hand side of your face would be kind of a mirage.
Right.
Went to the opticians, hoped it was that. But spoke to obviously my oncologist, and yeah, and then it kind of progressed quite quickly. I started to feel a bit nauseous. I was never sick, but and a bit dizzy, and it just got quite worse quite quickly, really. So
and we've been discussing before we got started around the language around we've gone with incurable but treatable, and but it's real tricky to work out what to say. And I was wondering if we could ask about, I'm an absolute novice in the language. So at first we talked about this being around palliative care, but I understand that's not the same thing. Are we able to check what is palliative care?
So the word palliative, I think the language surrounding palliative care is changing as we have more treatment options and opportunities for treatment. So obviously everyone, it's on an individual basis, but as in Sarah's case, palliative means, treatable, not curative, but treatable. So what do we mean by that? So treating either with therapy such as chemotherapy or radiotherapy in palliative doses. So where it won't cure it, it will manage or shrink, such as the chemo did, and or manage symptoms. We also, in palliative care, a large part of palliative care is looking at pain control, and I think that it's trying to gauge from the patient what words that they're comfortable with, because what we may associate with as a lay person, palliative some people may not have even heard of palliative. Other people might have heard of the Macmillan nurse or the Marie Curie nurse, and they might associate that with hospice and end of life. And palliative doesn't necessarily mean end of life. Yes, end of life is a part of palliative care, but as I say, you know, whereas before secondaries and metastatic disease would have, even, you know, not so long ago, meant a shorter time to end of life. Now we can prolong life, manage symptoms, manage disease, and I think it's really important to know what patients are comfortable and know the terminology, and actually ask patients directly what words are you comfortable with.
I think it's really important as well, the explanation that you've just given on palliative care, because prior to cancer my understanding of palliative care was hospice. It was keeping comfortable, you know, in the last few days. And when I first was given the word palliative, that was such a huge shock. But as you've said, it doesn't always mean that, you know, I'm a year and a half down the line. So, and it's totally different to what I expected.
And I think it's really important for us as healthcare professionals to we talk in jargon, and to break it down. And actually I always start with, tell me what you understand by this, and then I can take it from there. So patients are catapulted into a world that they didn't ask to be in, and they may only have a reference point of Holby City or you know, film. And like you said about not knowing what metastatic disease is, well, hopefully, why would you? You know, and this is the thing. So it's really important. I always say, tell me what you understand, and then I take it from there. What do you want to know? Because it may be different for one person. You said about receiving a letter, that about receiving the letter for the palliative dose, and you were like, well, what the hell does this mean? So I think it's really important for us to make sure that people understand what their treatment options are, what the intentions of treatments are, and that as healthcare professionals we will do everything we can, whatever that may be.
I think as well as a cancer patient, when, like you say, you are catapulted into that world, cancer is just one thing. It's just cancer. When you're within that cancer world, cancer is 1,000,001 things, and it's totally different. My experience will be different from somebody else's. Same diagnosis, but different treatments or different experiences. And I think that's really important to know that when you're embarking on this journey, to know that just because so-and-so experienced that doesn't mean, you know, that that's how I'm going to be. Or
and positives when people and I think it's just human nature. It's a bit like when you're pregnant and everyone wants to tell you their
and rubby tummy.
Rubby tummy, and everyone wants to give you their, you know, 87-hour labour story or their 2-minute labour story. You know, it's everywhere in between, isn't it? And you might feel those 101 different feelings in a day, and we'll talk about that, like, you know, a bit more, won't we? But I think yes, that as treatment options are changing, certainly I know my last tumour site, head and neck, you know, we're offering palliative doses of radiotherapy that would have been treatable doses 10-15 years ago. So it's changing all the time, and I think that can be really confusing for patients as well, when they're told, well, we can't cure this, but we can do this. That can actually be confusing as well. So patients like, well, if you can do that, then why won't it go away? You know, and so that's when it's really important to sort of manage expectations. And
I think it's useful to explain as well what the chemotherapy actually does, whether it kills the cancer or whether it shrinks it, controls it, whatever
controlling,
else.
managing. What do we mean by that? How are we going to measure it? What scans we're going to do? What does that mean? And also about, I think this is something that's really important to set the expectations for patients, that also the side effects of treatments can really be
far worse than the cancer itself.
So and I think I think that's really important for us to keep that conversation going, isn't it? And,
yes, definitely.
You know, and patients often will hang on to everything you're saying, and it's really important for all of us just to make sure that everybody understands, and the relatives. You know.
But when this idea that when you're going through treatment, when you're in like, and it's, you're kind of in I describe it like you're in a hurricane, and you are like, you're spinning around, and these things and words are being thrown at you, and I was 19, 20 when I was having my treatment, and you don't really like these things, but describing what the chemo is doing, what is that treatment doing to you, why are you having it. And I remember having, because I had the stem cell transplant, and being completely confused about I was in remission, but I was having this treatment that had the side effect of death, and you're like, oh, but when you're in that, when it's spinning around, you're just kind of doing whatever you can to keep yourself as firm as you can. I wanted to ask about so what's happening at the moment. So you're having chemotherapy?
Yes. So it's a targeted chemotherapy called Kadcyla. It's fairly new. I think it's about 3 years that it's been on the NHS. It's quite expensive, but it's very, very effective from what the research is showing. And that just involves every 3 weeks going to hospital, having a blood test before to check my levels are okay, sitting for, I think the actual chemotherapy takes half an hour to run through, an IV drip, and then saline either side, and then I go home and I carry on with my life. It's a bit like, you know, people that go to a nail bar, you sit and then you go home, and occasionally I feel a little bit sicky, but generally, you know, again, initially my fear was I'm going to be ill all the time, I'll be in bed, I won't be able to move, because that was my perception of chemotherapy. I haven't been sick once, touch wood. Yes, I'm tired at times, and there are side effects and there are symptoms, and you know, there are things that happen, but generally it's not at all what I thought it would be. But again, that's not the case for everybody. That's my experience so far. So.
And is that because of your previous experiences or perceptions of
I think it's just
treatment?
perceptions, just perceptions. You think, you know, with the word cancer and the word chemotherapy, you just instantly, oh gosh, that's grueling. And it is. I'm not playing it down. It is tough, but it hasn't been as bad as I thought it would be. My initial thoughts were, oh, I can't do this, and you can.